It was very painful. It was a sharp pain. I've been told I have a high tolerance for pain, but I kept going and kept going on it. I'd walk sometimes 6-8 miles a day, and it was agonizing. Some nights I would come home, sit on the sofa with ice packs on my knees, just like a basketball player or a football player. It was a chore to get up in the morning. It was a chore to get going. The main problem, the reason I didn't have it taken care of sooner, was because I was very heavy, which added to the problem. I was at one time 407 pounds. I'd seen Dr. Edwards for other issues, but I went to see him about the knee, and I talked with him, and he said that I would be a perfect candidate for bariatric surgery.
Inner joint space narrowing. He was at the point where his weight was so much that he would have been an extremely high-risk candidate for surgery. So we had a long discussion about decreasing his risk, and at that time as well, he was a diabetic, taking a lot of diabetes medications. He was also, because of his weight, it led him to have high blood pressure, so he was on several anti-high blood pressure medications. And so I told Mr. Rock, and we made an agreement that if he could see a bariatric specialist, and who's a weight loss specialist, and he could have a gastric bypass or weight loss procedure surgery, that he should be able to lose the ideal amount of weight that would take him from a high-risk candidate back to just regular normal risk. In high-risk situations, and it's usually based on several factors, such as the patient's blood glucose controls, their nutrition, if they smoke or not, and their weight. If they're a smoker, if they're considered morbidly obese, or have poor nutrition, they're at increased risk for wound infections. They're at increased risk for loosening of the implants. They're at increased risk for cardiovascular issues such as pneumonia and heart disease or heart attack.
Believe it or not, it's a small gas.
I had the gastric bypass where they completely they staple, and your stomach becomes about the size of an egg. The weight started coming off within weeks. It took approximately 1 year for me to lose all the weight, the 200 pounds.
Suddenly, when he did that, he no longer was a diabetic. He cut all of his medications down to basically 1 or 2. He then put himself in a position where he normalized his risk factors. He underwent staged knee replacements, meaning that we did 1 knee replacement, and then after he had several months to recover, we came back and did the next one.
I can do anything I want to do. I can ride a bicycle. I can climb ladders. I can tie my shoe, whereas before it was an effort to tie my shoe. There was a lot of things that I couldn't do. I didn't have the stamina. Walking was a problem, not only with the pain, but it was just an exhaustive process.
My girl, that's our baby girls, my little girls. I love y'all, daddy's girl.
I feel like a new man. Totally, I feel wonderful.
At Novant, we are a large healthcare system, so we have many people in many different disciplines. We've got all the pieces you need as a healthcare system. So it's not just that you're telling the patient, no, you can't have surgery. You're saying, okay, here's the risk. We want you to see this person. We're going to set you up for this evaluation. And so you give the person the plan, but then you actually get them to who they need to see.